This is Dr. Mathew Stockstad. What I want to demonstrate is some of the instrumentation that we use to adjust the vertebra. There's many patients who come in who are very squeamish at the idea that we may take and twist their head or twist their body in ways that they feel may be compromising their spine, and some people even fearing strokes because there's been a lot of information in the media which says that a chiropractor could cause strokes through the twisting of the spine. And I just want you to know, you can be rest assured that this is extremely rare, much more rare than having an incident happen from taking an aspirin or even a Tylenol. But nonetheless, we don't do those procedures. The first instrument that we use is one called the impulse. And if you look, this will not fire in the air, but with about 3.5 ounces of pressure pushed onto the end, the stylus will impulse very quickly. That happens so fast that your body does not even have a chance to respond to it. When we adjust the patient is sitting in a nice, neutral, relaxed position, and this will set the bone exactly where we need it to be set. No trauma, no pain in most cases. The next thing that we use is another instrument known as the arthrostim. What we find is that many patients who have had spinal injuries that have lasted longer than, say, a week will have compensatory mechanisms. If you injure one vertebra, the ones above and below will become stiff with that same vertebra. So we may need to adjust below that vertebra or above that vertebra. And what we do is we place this on there, and it impulses very quickly. It just taps into that vertebra. And if it's on something that is moving, as your back should move, there's little to no pressure coming back to me. But if we put it on something that is not moving, like a joint that's locked up, we have quite an impulse that will bounce back at us. So what we're looking to do is to feel this go from that locked position to an unlocked position. Now, the other component that many of our patients have is they've had these problems for a long time, and the muscles themselves, say if it was up in the neck, will be very tight that support the spinal column. And that we have what's called a percussor, which can be adjusted to many different speeds, but it punches way up and down into the muscle. One lady told me that it basically was the modern meat tenderizer, and I can't think of a better way to describe that, so that's what it is. It's kind of a muscle tenderizer, if you will. We're able to take and put this right over the muscle, apply a little stress over that muscle, and then just run this right along the fibers of the muscle, and it will loosen and tenderize the muscle, if you will, relieving muscle spasms. It's called myofascial release or trigger point therapy in the medical literature itself. So these are three instruments that I commonly use in my practice. They don't require any trauma to the spine, and most people say they feel wonderful. And so until next time, remember that good health happens by choice, not by chance. Until next time, thank you very much for watching.